Hello everyone, my name is Phil Diamond. I'm the spokesperson at the U.S. Embassy in Kampala. I'm here with Dr. Mohammed Lamorde at the Uganda Infectious Disease Institute. Welcome, Dr. Mohammed.
Thank you.
Great to have you here. We're here to talk about what IDI is doing, how IDI is helping with the COVID-19 response. Hear a little bit from Dr. Mohammed about his work. So with that, I'll start with the first question. Could you tell us a little bit about the Uganda Infectious Disease Institute and what its role is within the public health space in Uganda?
Thank you very much, Phil. The Infectious Disease Institute is commonly known as IDI. It is part of Makerere University, but it's wholly owned by Makerere University. It's a research and capacity building institute, and its main role is to strengthen health systems in Uganda, but emphasizing infectious diseases. So our role is to figure out how to support government efforts at national level, at regional level, at district level, with regard to health, and specifically with emphasis on infectious diseases. So at IDI, I lead the Global Health Security Program. It's one of the younger programs in IDI. IDI has about 6 programs, including clinical care, research, training, a health system strengthening, a laboratory program, but it's recently set up a global health security program. And I lead that department that really looks to confront health security threats.
How long has IDI been in existence, and what is the relationship between the U.S. government and IDI?
So IDI began operations in 2002, really expanded and became fully part of Makerere University in 2004. And really at the beginning, the efforts around IDI were to contribute to the HIV response. And so in 2008, the government of the United States, through CDC, U.S. Centers for Disease Control, gave IDI a first grant to support programming in facilities around Kampala. Since then, that support has grown on many fronts. Not only do we have support from CDC, we have support from the National Institutes of Health for research purposes. We also have support through the U.S. Department for Defense on specific health security projects as well. I can tell you that right now, the U.S. government is the most important contributor, the largest contributor to IDI's programming. And in a year, we have in excess of $45 million in terms of funding from the U.S. government. Most of that, about $38 million per year, is from CDC.
Okay.
Yeah.
There's a lot of attention right now on COVID-19, of course. What role is IDI playing specifically in the current COVID-19 response in Uganda as well as throughout the region?
So, with response, I think we also need to think about preparedness. We've been working with CDC for the last 5 years on a preparedness project. It's called the Global Health Security Partner Engagement Project. What that project does is that it looks to identify gaps in the health security system in the country, and then accelerates progress in terms of the country closing those gaps. And so since 2015, we've been working on strengthening laboratory systems, how to keep labs safe and ensure that materials don't get to unauthorized hands, biosafety and biosecurity. We've even worked on things like antimicrobial resistance. But about 4 years ago, we moved into the space of preparedness. And this is preparedness for outbreaks, mainly for viral hemorrhagic fevers, but really thinking across all types of outbreaks that could happen. And through those resources, CDC has supported us to have teams that are equipped, trained, and providing, in many cases, direct support to government. And so right now, you would have at least 3 senior epidemiologists supported through this cooperative agreement at the Ministry of Health, 7 laboratory staff at the National Reference Lab for Microbiology, or UNHLS. We also have 3 laboratory staff based at the Reference Lab for Animals, that's NADEC. In addition, we have staff that are pre-positioned in districts And it's really critical to have staff in the districts because they are able to work with district teams to jointly investigate and fill any gaps that might be present in terms of training. And a lot of those team members have gone on to play very prominent roles now in the COVID response. So we have people from the CDC COAG that have supported actually the training of trainers around laboratory aspects of sample collection. And they've used electronic technologies like Zoom to spread that type of training to all regions in the country. The epidemiologist at IDI was deployed by the incident commander to lead the epidemiologists at the points of entry and really supervise contact tracing around people coming across the borders.
Right now in Uganda, there's a lot of attention on the borders as we see cases being reported from truckers coming in from places like Tanzania and Kenya. So I think it's very interesting to hear what you're doing at the borders. Is there anything else you want to mention about what IDI is doing to prevent cases from crossing the border? It's a challenging task.
It is challenging. The ministry has been leading, and they've been leading quite effectively, but it's a big task. For some of these borders, we're talking about screening about 1,000 people per day. So Malaba in particular, there is a significant challenge in being able to screen everyone. One of the things that makes the screening difficult is that you really want to be able to test and know whether somebody has COVID before they enter into Uganda. And currently we've been taking those samples and bringing them down to the central lab, Uganda Virus Research Institute, for testing and confirmation. And by this time, the truckers have moved in. And so when people are found to be positive, they are traced and they are quarantined or isolated in health facilities. What is happening now with the National Reference Lab is there is an effort to see how they can spread testing through mobile labs. I'm pleased to say that one person also supported through CDC, based in the ministry, is leading the effort to deploy mobile labs. And those mobile labs will be able to reduce the amount of time to get results and hopefully in future even get results before the truckers move into the country. So that's a very important aspect that is happening.
Also, I was wondering if you had any words of advice to Ugandans, to the public, about how to slow the spread of COVID-19.
Thank you very much for that question. I think the single most important thing that Ugandans must do is to listen to the authorities. Listening to the authorities, not rumors, not unverified information on WhatsApp, but really listening to the government. When it comes to respiratory pandemics or epidemics like COVID-19, one of the measures is social distancing. How social distancing is applied will change from time to time, but the critical thing is avoiding coming in contact with people that have the virus. And so the government may say today and for a period of time we need to stay at home. When those messages come out, people need to respond and stay at home. If the government says people should not come within 4 meters away from each other, definitely people should stay 4 meters apart. Government is now recommending that people use masks in public. This is important because if you have the disease and you wear a mask, you limit your ability to spread it to other people. But above all, I want to emphasize something called hand hygiene. May 5th was the WHO Hand Hygiene Day. Cleaning your hands either with soap and water or with an alcohol-based hand rub is the most effective way of preventing the spread of germs from yourself to family members and friends, and even if you're a care worker, to your patients. So it's really important that hand hygiene is promoted at all times.
Well, thank you very much, Dr. Mohammed, for joining us today. The U.S. government is very proud to partner with IDI, and I think it's important to get out to the public all the great work you are doing. So thank you so much for your efforts.
We're very grateful for the support. Thank you.